Now, when we log in, there are two icons here on the screen. One is EMR, electronic medical record, and OP, internal referral, outpatient internal referral. So if any referral is being done by a doctor to any other doctor, and you have more providers, this is a dashboard where you can actually track. So nurses can track whether the patient has been referred to someone else in the facility, and also the front desk people can be informed and they can pick up the patient directly from here because they need to register the patient for another visit for the other provider. Okay. For electronic medical record, once we click, we can directly go to EMR workstation. So this is where all the information is being going. So once we click on EMR workstation, it directly takes us to EMR patient waiting list. So this is a waiting list for all the patients, and when patients are listed here, it means the patients have physically arrived at the clinic. Okay, that means they have been registered. Until the registration process is completed, you won't be able to see the patient here. Okay, so when the patient has been registered, the patient will show up with the status as registered here. Now, before I click on the patient, or we go ahead and see, there are other tabs on the screen, as we can see. One is appointment. So this is where if as a nurse you log in and access, you will be able to see appointments of all providers, but provider can only see their appointments because they only need to see the appointments that is there for them. Reports, this works when you have an in-house lab, not for an outsourced lab. ERX, this is a place where nurses can view the prescriptions without having access to doctor's workbench. You don't need to have access. All the prescriptions that being ordered by the doctor will be visible here. In case if you want to see what are the drugs, you click on this plus, you get to see the drug, the dosage, instructions, everything, all the information here. When I go to nursing, this is where you will get to see all the services that's ordered by the doctor. If there is any service that needs to be done at the clinic, like blood, CBC has been ordered, so you need to do the sample collection. Okay, so here you will see the CBC. So you will automatically have a service marking here called status action. Let me go and select service based. See status and action. So here you will have an action here where you can put in your comments like you're able to take sample or not, or like the example today, you're not able to take the sample, maybe in that case. So sample could not be collected. Okay, status incomplete. Okay, so people can track, okay, how it works. Okay, or if you have collected the sample, status completed. Okay. Then we go back to the waiting list. Now on the waiting list, we have got the patient. Now, when we click on the patient, we are now logged in as the nurse. So when we click on the patient, if it's an existing patient, okay, it will directly land on a page called visit summary. But this is not an existing patient. This is a new patient. So when there is a new patient, there is no summary available for that. Now, for a new patient, in order to do the nursing side, or we have mapped vitals as an element, we have mapped medical, family, and social history, and we have mapped patient and family health education record. Okay. Now, there is a form, paper form that you currently have. That's applicable for medical as well, right? The form at the registration, right? So there is a paper form which now the patient fills up for all the history. So they are ticking. Yeah. Oh, okay. That's fine. Then we do not have to discuss about that. Okay. So we'll directly start with vitals. These are some of the elements we have mapped. However, we have more elements than these. Okay. So we can map whatever elements you require, like a temperature. So you can put a reading of it. Height, weight. Okay. I will. Reading. I'll be putting a very arbitrary. Oh, normal. Okay. Usually it always turns out to be overweight when I'm putting height and weight. Blood pressure, you can record. Now, information that will be needed for the insurance to submit claims. We can mark those as mandatory. Like I think in Dubai, I'm sure here also, you need to send across the blood pressure, systolic, diastolic, every time a claim is being submitted. Okay, except pediatric patients. You cannot take blood pressure, pediatric patients. So we can mark blood pressure as mandatory. Automatically, it will be skipped if the age is of a certain range. Okay. So then you have pulse rate. Okay, and whatever information you are feeding in here, it will be automatically passed on to the doctor. You can review that information. Okay, if the doctor wants, the doctor can override that or record another set of vitals in case if the doctor wants. Okay, SpO2. Yeah, so what these are some standard panels, modify them. So we have more. We have pain scores with faces. We have nutritional assessment, Yeah. So after that, we have something called allergies. Now, in order to document allergies, you first have to uncheck this. It's okay, you can give me the points later. Just yeah. So if you have to document allergies, you first uncheck this. Once you uncheck, you are declaring there is no known allergies. NK, no known allergies. So then you can start documenting the allergies. Okay. So for drug, we are going to map all the generic compositions of the medicine. Okay. It's not mapped. That's why it's showing rash. Okay. Okay. So we will be mapping that like paracetamol, cetirizine. So whichever drug or generic composition against which you are putting the allergies, the doctor will get notified when he is prescribing drug if it cross matches. So we'll automatically giving an alert to the doctor that a patient is already allergic to this. Do you still want to prescribe? When the doctor clicks on yes, then only it will be added to the prescription. Okay. So then we have got food and substance. These are text entries. You can just add it. Okay. In case if you want to build a master like food, like if someone is allergic to milk, okay, you would not want to be typing milk. So when you add milk here, okay, and reaction you're putting in, rash or severe. Before you click on add, what you can do is that you can click on this plus. When you click on this plus, milk will get added to the database. Next time you choose milk from the drop down, you don't have to type it anymore. So you can keep on building your databases as well at the same time on the same screen. Okay. Yeah. Okay. So we will. Yeah, exactly. Sure. So click on. Okay. So I have added an allergy here. Then we move on to the medical, family, and social. As many as you want. As you can keep on adding, it will just keep on adding. Then we have medical, family, social history. Okay, so we have got past medical history, past surgical history, dental history is not, we can map it, personal history, then we have family history. So you can have a single called family history, or we have separate groups as well, children history, then ancestral history. So you can document it separately, or you can just document it in one block as well. Then we have social history. For social history also we have smoking history, alcohol history, substance abuse. So you can have that as well, other substances. Now, one thing is there, when you are actually writing here, one thing is we will carry over that information as well. So suppose this is a new patient, you have written it now. If the patient comes back, when you open the page for this patient on the next visit, automatically everything will be filled up. If the history has changed, then only you edit it or document it again. Otherwise, you can keep the same. So we are carrying it over because there is less chances of the history changing frequently. That's one. Second, if you are writing similar things for all kinds of patients, like past medical history, example, diabetes. Okay. So DM. Okay. If you're writing. So instead of writing that every time, you can also start building your favorites. So all of the boxes have favorites in them. Okay. So you can define a condition, So it gets added here. So in order for me to add it, I just click on favorites. Done. It gets added. Okay. If you add more than one at the same time, it will automatically get added separated by comma. So same way, all of these text boxes have a favorite option. Okay. Now you might have noticed we have got this triangle. Okay. What is this for? This we call this a warning aggregator. So basically, anytime you're documenting something which you think is a warning sign, okay, any flag, you're noticing blood pressure, it's a warning sign. Okay, you do not have to go ahead and document it anywhere. Just tick this box, and automatically there is a warning calculator. It will keep on calculating warnings. So if the doctor wants, the doctor can just click on warnings and see all the warnings documented across, but even during vitals. That's why we designed it as the triangle which you put on the road when you dig the road and someone is going to go down. Also, at the same time, there is a free notes option. So here it can be, like in case if the doctor wants to write the history, descriptive, so you can document it here as well. Complete documentation of the history. And we will automatically pick up this section and put it in the history section when we build the medical report. Then for the nurses, we have patient and family health education record. Okay. I'm not sure if you are aware of this. This is something where you actually describe whether the patient is able to, capture the information or communication that you're passing on to the patient. If you're passing it on to patient or the son or the father, okay, what are the barriers? Okay, why? I'll answer that question first. HAD is working on to make this as a mandate very soon. Okay, because they would want to know whether the communication that you're giving to the patient, whether that is being understood by them or not. So actually, there is a report that HAD is working on, which will become a part of a they call it mandated KPI reports. So there are mandated KPI reports. So this will become one of the KPI reports where we have to design a report which will pull all the information that these patients have been told, these patients have been, and there will also be report based on these barriers. How many patients have physical barrier? How many patients have cognitive barrier in understanding? Okay. So they are working on the statistics. So that's why we have introduced this. Okay. Because already we got this as a request from other clients in Abu Dhabi. So in case if you want to add more than one row, click on this. It will keep on adding more rows. Here are the legends for you. See here, PT, patient, SO, son. So learner, who is the learner? Means who did you speak with when you are explaining the medications or when you are explaining whatever the doctor has documented. Did you speak to the patient itself? Did you speak to the son? Did you speak to the spouse? If it's spouse, you write SP. Okay, language. Here, Arabic, English, others. See, all the legends are here. Okay, so use Arabic or English or others. Barriers. Here you have all the legends for barriers. So you select which number. Maybe he has cultural barrier. Okay, whatever you're trying to explain to them. No, I cannot accept this. We don't do things this way. So the patient has a cultural barrier. So you document that information as 4. Well, these legends are created by Hath. I did not create them, so maybe DOH when they think of NHL variant. Yeah. So now, apart from vitals, medical family social history, and patient and family health education record, you also have access to something called documents. Now, what is documents? When you click on this, okay, cancel. Let me save. Once you have finished, then click on save. Okay. Click on complete only when you've finished documentation. In case if you're going to make any changes further, don't click on complete. Keep it saved. Finalize is disabled. It works on auto finalization. Moment the submission is done, the claim, all records will be finalized. Now we go to documents. What's documents? Document is for uploading documents that the patient is bringing. Old medical records, old lab reports, radiology reports, even labs that you're sending outside. Okay. Now, when you're receiving the test result currently, like labs that you're ordering that is going outside, when you're receiving the result, it comes in as an email, right? Or PDF, right? So when you receive that, do you inform the doctor or the doctor directly sees? Are you directly seeing? You come, they come to you as well, right? Okay. So what? Now it comes in as an email. Okay. So now then someone is downloading it and uploading it as a part of it, right? Or attaching it, right? So what can be done is that when the nurses get the result, they can click, they can go ahead and select the particular, suppose they select a PDF. Okay. When you select the PDF, see here when I click, I get to select the option. Okay. So you download and keep it in a folder and then you select it from here. Okay. Once you do that, see, we'll automatically pick up the name of the document by reading the document. Okay. Here you select what type of document it is. So automatically it will go into that particular folder. Okay. So suppose it's a lab document. So we select lab. Okay. Now there is an option called review, no or yes. Now how this helps the doctor? When you're uploading, if you mark yes, the doctor does not have to ask you whether the report has come or not. When the doctor logs in, we have something called a review status. I will show you that as well. So if I mark it as yes, share with insurance company, these are not needed. These are specifically for some other reasons that we have created. Just if you want to put any comments, okay, in case if you have reviewed, if you want to put all those comments, click on save. It gets saved here. Okay. The doctor can directly view it as a part of the system. It opens up on the browser itself. Only if it's a PDF or a JPEG. Okay. Now, when you have set it as review, I'll go back to EMR. Okay. You can see these icons are there. This is there for the doctor. So the doctor, what the doctor can do or anyone can is, one is this where you can see the number of patients waiting. Okay, at any given time. This calculation is done based on patients which you have picked up and you have filled up and you clicked on save. Moment you clicked on save, the count goes down from here. So this is the difference between number of registered patients against the number of patients that have been documented as EMR. That's one option. Second, there is a task option, and here we'll be bringing a review status option. So when the doctor logs in, when he clicks on the patient, here the counter will keep on increasing. So when you upload lab reports and you set up review yes, the doctor will automatically know there are 2 documents I need to review. So you do not need. So doctor, when he clicks on that, directly the document will open up. Then you can start reviewing. So that's how you do the nursing side of it, the documentation. Okay. Now we will go ahead and log in as the doctor. Is there anything else that you do? Once we go to EMR workstation, same waiting list. Doctor can see whether the triage has been done. Patient will come into this list as registered. When you save and complete, it will become triage complete. The doctor knows vital is done. So then he can start checking on the patient. Okay. if now the patient has become an existing patient for the doctor, since you have already documented information. So when the doctor clicks on the patient, it will land on patient visit summary. We have already created the summary based on the vitals that's just been recorded. Okay, and if this is being recorded over and over again, for multiple visits, then the doctor can also click and do a charting, trend charting. So automatically it will start doing graph. Okay, then so you can scroll down and you can see all the records for past visits. It will all be summarized together. If you want to see a consolidated view of all complaints and diagnosis, click on history. We will consolidate everything together. All chief complaints together, all diagnosis together, all services together, all prescriptions together, everything together in one screen. Now go to visit entry. So whatever has been documented for the patient gets carried over. So you just review that information. Then you move on to chief complaint. It's a text box. You can write. You can build your favorites as well. Okay, where just yes. Then there is faces pain score. Okay, and these are I'm not sure whether you are actually currently filling this up in this manner or not. These are called history of HPI factors: location, quality, severity, duration. Yeah, good damage. Yeah, yeah. And once again, there is a free note. Okay. Now there is one approach that we have is, if you want, we can include this as a part of medical report automatically, whatever you write. Or there is an option where we can disable these boxes at the bottom from being carried over to the medical report. So whatever you write in these boxes stay as a part of patient medical record, but does not print out in the medical report. That is in case if you want fields where you want to document information which you do not want to print out as a medical report. Okay. Information. Yeah. All this can be rearranged. So then we have medical family social history. If it's documented, it will get carried over. Okay. Diagnosis. Okay. So currently, either you have the option of writing the narrative diagnosis here, which gets carried over to the coders for them to put in the codes, or all the codes are mapped here. Okay, the entire ICD-10. Either you can build your favorites by just clicking the star. Okay, so let me go ahead and yep. Can you give me 20? Okay, okay, okay. I'll add this. Now I've added two favorites. Okay, I'll remove this. When I click on this, the entire list comes. If I want to see only my favorite diagnosis, I don't want to search everything. Check this box, then click. Only list of favorite diagnosis will come. In order to add a diagnosis, it's click, it gets added here. You click, it gets added here. Okay. And doctor, in case if you want to put the condition of the diagnosis, here's the option. In case if there is a patient has some chronic diagnosis, so you can mark it as chronic here. Okay. What's the benefit of that? Okay. This Uh, that currently is something that we are building. Okay. When you mark diagnosis as chronic, we are going to put a data analytics at the back end of the system where all these chronic diagnoses will get flagged. The moment any provider opens, they know what are the chronic diagnoses. Okay, that's one. Secondly, based on this condition, there is a scoring. It's called evaluation and management score. That basically the coders, they have a manual sheet. Okay, they go through your entire thing, they put in the codes, then they put in the condition reading, and based on that, there is a score, score 1, score 2. So actually, our system is designed with the scoring at the back end. When I'm putting in these diagnoses, the scoring has already started. So by the time the data goes to the coder, they already have a button which says suggested E&M score. So we have already done a fair share of calculation for them. They just validate whether we calculated correctly or not. Okay. So these are the two advantages. Okay. At the same time, you can also see the diagnosis history directly on the screen itself. Okay. All the diagnosis that has been put in. Now, services. This is where you place the service orders. Whatever needs to be done. If it's an external lab that you need to send out, or there's a procedure that you want to do, okay, all these services needs to be documented here. So you can search 85025. We have 85025. Yeah, 85025 is supposed to be CBC, right? Culture, fungi, mold, or yeast. Wow. No, I think CBC is included in this 75221. Yeah, this is CBC. So, in case if you have to order, just click on the number, it will automatically get added here. Okay. When it's added here, that means it's added to the bill. You don't need to send. It will directly available to the biller when they bill. Here, quantity. Yes. And whatever quantity you put, it will go to the billing also. So automatically it will calculate for them. And also there is one more option. In case there is some discount that you want to communicate to the front desk, you do not need to call them or tell them or write. Just put in the discount percentage here. It will go as a message when they open the bill. They need to take an approval, then they can apply the discount and send it. Okay. Now one more thing is here. This is based on the example you gave when you came in. Insurance covered or not. Okay. So when you're ordering a service, if it's not covered by insurance, it will automatically show in the bill with cash and they know they can inform the patient. Okay. And we will switch it to cash price as well for the billers. Okay. So this is like for you to also know whether it's covered or not covered. You don't need to ask. So you can also tell the patient, that I'm ordering a service which is not covered for you. You would need to pay in cash. Okay. And the front desk can also inform him when they're billing. At the same time, you can build your favorite services by clicking on the star here, star, like faint concept. In case if you want to search within your favorites, you click favorites and you can search. Now it will only show favorite services. Also, there is another option called order sets. Lab, we have created 4 categories. So you can create your own order sets, like for asthma, these are the lab orders. So then you'd never have to search. Select, add to visit, done. I remember this was asked when I came up. Yeah. So that's we have. So I'll just create a. If you can give us those bundles, then we can pre-feed it into the system. Yeah, if you have. Yeah. So this is that order set option. Then we also have the service history. So this is where you can review all the services that's been ordered before. Okay. Treatment plan. Now, treatment plan. Now, when you are ordering services, are there services that you are planning for future for the patient? Okay. So, no, that's basically like no, I mean, any kind of services or procedures that you are thinking to do to the patient, but you're not doing it now. You're adding it as a plan, right?
So like if the person gets caught, he's gotta come back to have a drug challenge.
Oh, okay.
Like they get
Next, drug charge. Okay. So what you can do is that you can search. Oh, is that a service? Drug charge?
Now you find those.
Oh, no. Sorry. My bad. That's why. Whatever. 95075. Okay. I think there is something wrong with the code description, so we need to check that out. Huh? Yeah, there's something with the code. We need to review that. So, okay, just give me 1 minute. Pause this.